Are you living with dizziness? Many of you are and don't know that you can do something about it. I'm here with Dr. Danica Watson from Lot Physical Therapy, and she's going to walk us through what you can do to stop living with dizziness today so you can get back to doing the things you love to do tomorrow. So, Dr. Danica, what's the difference between a patient just learning to live with dizziness compared to actually getting it assessed and treated by a vestibular specialist like yourself?
Oftentimes people will come in and say, I have dizziness, or I'm off balance, or I'm unsteady and there's nothing that I can do about it. And that is most of the times not true. As physical therapists and as a vestibular physical therapist, there are lots of treatments that we can provide for people that have dizziness. And I've seen multiple patients in the last year or 5 years even that have come in and felt like there's no hope and that they can't get better, and that's oftentimes not the truth.
So, Dr. Danica, you mentioned that there are a lot of patients that feel like they don't have any hope, but you've in fact identified many of these patients that had no hope end up having a very treatable dizziness issue. What do you find is most commonly the problem, and what does the treatment look like for those problems?
A lot of times if people are having vertigo, which is the room spinning around them, there's a treatment that we can perform that can get that better within, on average, 1 to 3 sessions. So that's usually the most common form of treatable dizziness. Is I lay down, I get a spinning sensation, I sit up, it goes away, and that's the quickest fix that we can provide with physical therapy.
So you mentioned symptoms such as laying down, feeling the room spinning around. What other situations will someone oftentimes experience that type of vestibular kind of vertigo symptoms?
If they are looking up to turn off a light, or if they are at the dentist, in the dentist chair and they lean back, or if they're getting their hair done and they lean back, then you could also have a spinning sensation that'll come on and be temporary and then sit up and it'll go away. And that's a very treatable form of dizziness.
So when you mentioned that many of these patients, they have no hope. Oftentimes when I used to see patients with vestibular issues, they would just start avoiding those activities.
Right.
What problems can that cause when they avoid going into those positions that cause their dizziness, or avoid those activities that are causing their dizziness?
Right. So a lot of times people that are having spinning when they lay down on their back, for example, will avoid laying down on their back. And so they'll sleep at night with 2 to 3 pillows underneath their head. They'll never get their neck back. And so that can not only result in neck pain, but also neck stiffness, not to mention like fear of falling and being apprehensive with movements, that can also come along with dizziness symptoms.
And I've even seen patients with very, kind of the same thing you've talked about, where they now lay in a recliner or they have 3 pillows under their heads, and they start having headaches and neck pain. I've even seen patients that haven't in 20 years rolled over on their right side because it caused dizziness every time. So now they have to roll on their left side every time getting out of bed. They have to change the way they live because of that dizziness. In fact, 20 years ago, they could have had it treated if they had the right therapist like yourself. So pretty interesting. So Dr. Danica, you've talked a little bit about the more common types of dizziness that you do treat. I know there are other types of dizziness that you also treat that are maybe less common and a little bit more difficult to treat. Take me through what you do to help make sure that those patients get the best care and get better as fast as possible as well.
Right. So when people come in with dizziness, I like to tell them that dizziness can be an umbrella. So that can mean there's multiple different things that are causing their dizziness. So part of my role is to try to help put the puzzle together and figure out what specifically is causing either dizziness, which could be spinning, or it could be being off balance, or it could be feeling lightheaded or being afraid of falling. So part of what we're doing on our evaluation is trying to determine why they're feeling dizzy and what that actually means.
So take me through, obviously that involves a very thorough assessment. Do you have any tools or technology that you use to really understand what the problem is?
Actually, we just received a new pair of vestibular goggles, and these are extremely valuable and helpful for not only assessing, but also treating patients that have dizziness and vestibular conditions. It has the option of being able to video eye movements, which can really help us be able to treat the patient more efficiently and effectively.
Another thing that our team is really big on when it comes to patient care is a team-based treatment approach, and that allows us to ensure that patient gets better as fast as possible. So how does that work when it comes to vestibular treatment? And take me through some of your team members that are involved in treating patients with vestibular issues.
Right. So Dr. Roper at the Ennis location and myself have the most vestibular training. And so we've taken multiple courses and both have certifications in treating vestibular conditions. So we are primarily the ones that are helping with diagnosing and leading our team on the right path with treating these patients that are having dizziness or balance issues. And so it's our responsibility to be able to communicate with our teammates and make sure that they have a good plan to be able to help these patients effectively.
And Dr. Danica is being modest and humble, but Dr. Roper and Dr. Danica have what are board certified specialists in neurological physical therapy, and they also have advanced training with vestibular specialty. And so what's really interesting about that, they're in for about a 60-mile radius. They're among the elite from a physical therapy treatment standpoint for neurological disorders. So don't let her fool you. She's incredible, and so is Dr. Roper. So a lot of people think that dizziness is part of aging. What is it like for you to have someone that believes that and then take them through a physical therapy treatment and then learn that that's not true?
Right. I mean, I can think of one patient specifically that had been dealing with spinning, vertigo, dizziness for 20 years, and they thought that was just how their life was going to be. And then after we did the treatment, it was better in 2 to 3 visits. And so that can be extremely valuable and rewarding for showing people that can improve quickly. But I've also had a lot of people that come in and they're off balance and they're unsteady and they believe that that's just an aging process. But with therapy and a lot of repetition and practice regarding their balance, then they're able to make a ton of progress, be able to get off their walkers and their canes and feel safe and confident and get back to living life without the fear of falling.
And I just from a outside looking in observation, it's pretty incredible to see many of our patients after 6 weeks of coming to physical therapy, from the day they walk in. Oftentimes we'll do video analysis and evaluate the way they walk in and during their initial examination. And then it's so cool 6 weeks later to do that same analysis and see how much improvement they've made. And not only does that improve their quality of life, now they're able to do the things they love to do again with the people that they love to do it with, which is so cool. So very cool to see that. So Dr. Danica, if you could tell someone at home that is struggling with vertigo or dizziness one thing, what would that be?
Definitely to not wait, to come get help, to come to physical therapy. Even if they feel like we're going to test them and we're not going to find anything, that's oftentimes not the case, number one. And number two, it could be life-changing.
Is it possible that by waiting, the problem can actually get worse?
Absolutely. You can change the way that you move. You can become more fearful. You can increase your risk of falling is the number one risk factor of a serious injury. So
one of the analogies we oftentimes give here at Lot Physical Therapy is it's kind of like your car check engine light coming on and you ignoring it, and then the next day you get in the car and you ignore it again, and then you keep ignoring it. The longer you ignore that check engine light, the bigger the problem can become. And so, like Dr. Danica said, get it checked now. That way you can figure out what the problem is and treat it sooner rather than later. So Dr. Danica, considering all the many specialties that there are in physical therapy, why does specializing in neurological and vestibular physical therapy feel like the right fit for you?
I feel like those doors have just been opened. When I was a new grad, I applied for multiple different places, and I feel like the Lord just led me into neurologic rehab, and I've just stayed on that path, and coming to Corsicana, there was nobody to treat vestibular conditions and nobody to treat neurologic conditions, and so that was a huge open door for me, just to have the opportunity to help our community and help people struggling with those conditions. And I've just really developed a passion for those conditions specifically.
So if you didn't know, Dr. Danica is actually my wife, and our family mission statement with us and our 3 children, 8, 5, and 3, is to live a life of impact and influence. And if you could see this community and Lot Physical Therapy today compared to what it was in 2017 from a vestibular and neurological treatment standpoint, it is completely different. And it is incredible how much we have grown in our ability to care for patients with neurological and vestibular disorders. And so there is no one better in this county or any county around us than Dr. Danica Watson or Dr. Lindsay Roper in treating vestibular and neurological issues. And so it is to your benefit of your life and your quality of life to come see one of them if you are having any of these issues. So I also want to mention, if you're a student and you're interested in treating patients with neurological or vestibular disorders or wanting to specialize in that long term, our 6-month mentorship program, we can actually pair you with Dr. Danica or Dr. Lindsay Roper to get the mentorship you need to accelerate your growth towards getting board certified in neurological physical therapy. And we actually will pay for your board certification exam. We will help guide you through that process so that you can get as much training as possible, as quickly as possible, so you can help your patients get back to being their best as soon as possible. Dr. Danica, thank you so much for joining me for these videos today. You've been super helpful. We'd love to hear about your expertise, and I think you're gonna add a ton of value, not only to the people that watch this video, but the patients that you're gonna be able to serve long-term. So thank you so much. So if you are someone who has been watching these videos today, thank you for joining us, first of all. And second of all, if you or someone you know and love are having issues with balance or dizziness, I would encourage you to do something about it today. Don't wait until tomorrow, because tomorrow can be better if you will do something about that dizziness today. And so feel free to reach out to us. We would love to help you. Again, Dr. Danica and Dr. Lindsay Roper are incredible. And if you have found these videos to be helpful, please subscribe to our YouTube channel. We try to create as much valuable content as possible to be helpful to you, and we would love for you to follow us on social media as well. So thank you so much, and hope to see you soon.